Hey everyone, so we will be analyzing health in Thailand. So first for some demographics, there are around 70,100,000 people who reside there. There is a 0.96 to 1 male to female ratio, so there are more females than males. Life expectancy is about 73.6 years, with women typically living about 7 years longer than men do. The unemployment rate is about 1.02%, which is below the national average, as well as the poverty rate being 6.2%, with that also being below the national average. The US, I believe, is around 9%. And then the births per year and deaths per year, these were the 2020 statistics. Typically over the last couple of decades, the deaths per year have been more than the births per year. And if we look at the population pyramid, we see that around ages 50 and 40, their births were a lot more than that of the younger generations. And this is due to the family planning program. Around the 1970s, Thais started seeing a rapid increase in children, and they were getting worried about overpopulation. So the family planning program was implemented, and it really just encouraged the voluntary use of contraceptives. It celebrated easy access, and Buddhist culture, we'll get into that later. It did reflect that. So to continue, healthcare in Thailand, they use a universal healthcare system. So it's the Universal Healthcare Scheme of 2002. This was because, as the Minister of Public Health in Thailand said, because we were poor, we cannot afford to not have universal healthcare coverage. So this was a reflection of really in a state of struggle in providing healthcare so that there weren't as many problems. So this is funded by tax revenues. There are private and public hospitals, and pharmaceuticals are really come at low cost because Thailand manufactures its own drugs. And around 10% of the population uses private healthcare, but the universal healthcare coverage is pretty good. So when we get into communicable and non-communicable diseases, ischemic heart disease is actually the leading cause of death. And after doing some research, I've kind of determined that this is due to the sedentary workplaces that a lot of Thais live in. Food is not really a big leading cause of death. Thais tend to cook pretty healthy and hearty meals with a lot of vegetables, and many Buddhists actually eat vegetarian and vegan diets. So it's very interesting that that is the leading cause of death. Lower respiratory infection is the second leading cause of death, and that is a communicable disease. And then we have stroke, chronic kidney disease, liver cancer, lung cancer, and Alzheimer's. So we'll get into religion in a little bit, but Buddhism, Muslim, and Christian are the primary religions in Thailand, with around 95% being Buddhist. So as mentioned before, Buddhists seek healthcare and believe it to be important. Their values are reflected in the healthcare system here in Thailand. And many also follow vegetarian and vegan diets. And then the family planning program does reflect this. So when it comes to demographics and health, inequality is a really big deal in Thailand. It's an upper middle income country. It used to be a developing country, but it has made progress. But there is a lot of wealth inequality. If you look at this pie chart, around 78% of the wealth in Thailand is withheld by the top 10%. So that is a really big income gap. The bottom 90% of people own 22% of the wealth. So road accidents in 2009 were actually the third leading cause of death. And this is due to inequality in economic status. So many people drive scooters and bikes versus driving SUVs just because it's cheaper. And so SUVs, when they come in contact with people around scooters and bikes, it leads to deaths, it leads to major health problems. So the inequality was a really big issue. So another important part of global health specific to Thailand are their epidemics and endemics. The epidemics include malaria, Japanese encephalitis, and leptospirosis. Malaria is very prevalent in Thailand, so they've had to do a lot of control to really try and fix that problem. Endemics include distal renal tubular acidosis, um, and dengue, and they are also in the process of adding COVID. Actually, within the last week, there's been a lot of talk about adding COVID to their list of endemics.
Thailand as a country has made tremendous progress and even reached many of their sustainable development goals. They've assigned government officials all over Thailand to be responsible for 169 total targets related to the SDGs that would help them reach their goals. Out of the 17 sustainable development goals, the ones that have been achieved or significant progress has been made on include eradicating extreme poverty, improving nutrition, universal health coverage, and educational equality for boys and girls. Thailand has the resources and abilities to reach these goals and are making necessary changes that would aid them in doing so. Thailand was able to reach many of their Millennium Development Goals prior to 2015. Thailand places its people at the heart of development by investing in them through development and healthcare programs. These programs help the people of Thailand to stay healthy and have enough money to not be in poverty. Even though some of these goals were reached, there are still some rough areas within. The target to have the number of people suffering from hunger was reached, but now there are nutritional issues in children that the Thai government has to worry about. Rates of HIV/AIDS have been decreasing since the start of the goals, but malaria is still an issue in rubber plantation areas. Tuberculosis infections increased rapidly after 2000, but started to decrease after 2010. Around 90% of all tuberculosis patients in Thailand have been treated. Thailand has also been an active regional player in assisting countries to attain their MDGs. Their efforts have reached neighboring countries in Asia and regions like Africa and the Middle East. Thailand became an upper middle income country in 2013. Their GDP is 501.8 billion US dollars and per capita is almost 7,200 US dollars. The poverty rate is 6.2% and the current inflation compared to last year was 0.82%. Thailand has a free market economy, and with that comes a strong domestic market, a growing middle class, with the main economic growth coming out of the private sector. Thailand's economy benefits heavily from the well-developed infrastructure in the country. Thailand spends about 47.9 billion US dollars on healthcare, which equates to about 6.6% of their total GDP. Major industries in Thailand include tourism, agriculture, exports, and technology. Tourism accounts for 15% of total GDP and agriculture roughly 10%. Rice is the country's most important crop. In 2020, Thailand had a trade surplus of 20.4 billion US dollars. Top exports were gems, precious metals, rubber, fuels, and technology. Most of the technology exported out of Thailand are cars, electronics, and medical equipment.
Thailand culture is a culture that is basically mixed of a bunch of elements from other countries in the surrounding area, which include India, China, and then other South Asian countries. So I've got a little arrow right next to India and China, and then of course we can see Thailand is here in the middle. So Buddhism is the primary religion of Thailand. It does influence the cultures and practices of everyday life pretty generally. The central theme is for refinement. So basically, you'll never see like a person in Thailand, their face break. It's considered to be rude. So they're basically like keeping face. So you avoid any kind of strong expressions. So just keeping a happy smile on your face, looking kind of blank. And then also avoiding causing others to lose face. So that's anything from like strong emotions, like again with keeping face or losing face. Physical unclean is something that they're particular about when it comes to like feet and gesturing with your feet or pointing your feet towards someone. And then here in the bottom corner, I have the way that the Thai people tend to greet each other. For the older the person, the farther down the bow is. It's just kind of supposed to be for more respect because they honor their elders. So it is very similar to Latin cultures in Thailand in the idea of family being one of the most important building blocks of their everyday life. So it is really common for multiple generations to live together in one household. So in the upper left corner, you can see over here, family with, I'm assuming the grandparents share multiple meals throughout the day together. You can see kind of down here, this is another family. And then in the upper right-hand corner is actually the royal family. There's actually a news article that I saw this past week, where someone kind of trashed one of the royal family members on Facebook, and I believe they got sent to jail. They are a constitutional monarchy, so the royal family is something that is very important to them. These are the indigenous people or populations that are recognized in Thailand. So most of them live as fishers or hunters and gatherers. They live in 3 different geographical regions. So some are indigenous fishing communities, some are hunters and gatherers. And then in the north and the northwest, they've got a lot of different types of highland people that kind of go into their own little section. Indigenous people are about 7.2% of the Thai population. And then at the bottom, I wanted to talk a little bit about COVID. So the indigenous people especially were affected by COVID as it forced them to move to the cities, which kind of gave them a list of difficulties, things such as employment, lack of income, they didn't have enough food for families, and then they didn't have the land that they used to have that they lived off of and couldn't travel back to their community.
All right, so education in Thailand. Education is provided mainly through the government, and it's divided into 3 categories of pre-primary, primary, and secondary school. So kids typically get about 15 years of free education. The primary school completion rate is 95.06%, whereas the secondary school completion rate is about 85%. So we're seeing a rapid decrease in students finishing primary school versus secondary school, and we'll get into that in a little bit. So Thailand also has very effective sexual education programs. As mentioned before, they really value the use of contraceptives and educating people about sex ed. So in Thailand, there's some excellent public schools in Bangkok. They also have tutor schools, which help kids who might need a little extra help in their classes. So in those big city areas, they do have better public schools. However, in rural areas especially, the public education system is rooted in inequality. Public education is not prioritized, and there's also hierarchy in community. So kids who might want to go play outside, they're nervous about playing outside because there's that social hierarchy. We're also seeing that 14% of secondary age kids are not in schools. So there's that rapid decrease between primary and secondary schools, and this is primarily because of low wages for teachers. The education system discounts poorer sectors, as well as not adhering to disability standards. There's also a lack of exercise in kids due to that community and that hierarchy. And pesticides also has a lot to do with it. So that environmental factor really influences kids being able to go and exercise. So the education system is supervised by the centralized bureaucratic system. So there isn't participation from communities and parents, so they're not getting that firsthand opinion. So private schools are a possibility for people who have more money, but for people who don't have as much money, they're forced into the public education system. Skills are not being as developed. Western teachers, people who have more money are able to hire Western teachers. But again, that's not a possibility for a big chunk of the population. UNICEF is doing a lot with Thailand right now to try and get their education system in a better position. So there is a poor education system in Thailand. Improvements are slowly being implemented, but as of right now, they're not in a fantastic position. And again, like the Minister of Thailand's Public Health said, because we are poor, we cannot afford to not have universal health coverage. So this is an example of that, really reflecting the Minister of Thailand's Public Health, why that was implemented. The education system isn't great in Thailand, but having universal health coverage can solve some of the issues that they're experiencing. So we've gone over all of the determinants of health when it comes to economics, education, healthcare, environment, and community. Thank you so much for watching.